Moment. I want to go across now live to one of India's finest epidemiologists, Dr. Giridhara R Babu, runs epidemiology at the Public Health Foundation of India. We've really benefited from his insights throughout the last several weeks. Devendra Sharma also joins us, works deeply on food policy and planning in the agricultural sector, understands rural India better than most people in our country. I want to go across to the Corona India dashboard and I want to show our viewers where things stand at this moment. That is key. Remember, the number of cases in India has crossed 10,000. I want to show the trajectory tracker curve across different states. And then, Dr. Babu, you can explain which states are you most concerned about at this moment? What would you, from an epidemiological perspective, we've been hearing corporate India speak, we've been hearing government ministers and bureaucrats speak. We've also heard what India Inc. says. From looking at the data in India at this moment, what would you like to hear the Prime Minister say from a public health and disease control perspective?
Thank you, Rahul. If you could recollect our conversation just before Janata curfew was announced, I had informed that at that stage lockdown was absolutely necessary, whereas the global opinion at that time was that India may not need lockdown. Having gone through this period, now there are some states which are doing really well and some which are not. In my sense, if you look at both testing rates and the case fatality proportions, I think the most focus will have to be in the states of West Bengal.
Perspective, Dr. Babu, I want to draw you further. Which states do you think have done really well? Which states do you think haven't been on the ball in fighting the disease?
Sure. So if you look in terms of testing and also case fatality, the lowest case fatality and also high testing is seen in the states of Andhra Pradesh, Chhattisgarh, Delhi, Goa, Haryana, Karnataka. Whereas if you see low testing and high mortality, then you will see Jharkhand and West Bengal on the top. So which means, one, we are not finding enough cases early enough, and we are also not treating well enough. So this we published as a statewide analysis in the BMJ. And low testing.
I think this lockdown has gone. I want to show you what the curves look like. A lot of global thinking was maybe India doesn't need the lockdown. Remember, this dotted blue line is the line where a state would be if the number of cases was doubling every 2 days. This dotted red line is the line where the state would be if the number of cases are doubling every 5 days. Mercifully, we don't have any state at this moment on the left side of the dotted blue line, which means there's no place where cases are doubling in less than 48 hours. There was a period, just zoom in further so you can see this. There was a period when Tamil Nadu and Delhi were in a zone where the number of cases was doubling in less than every 48 hours. That now has changed somewhat. The longest curve is in Maharashtra, the dark saffron, where you've got the longest line of cases, the max number of cases are there. Kerala is the one state where, just if you look at the data, no matter what your political affiliation may be, that's the one state they've been able to flatten the curve. It started out with a lot of cases coming in, but over the last several days, like South Korea, like Japan, like China now, they've been able to bring the curve under control. Now, what I want to understand from you, Dr. Babu, is could this change? If, for example, the trend in Kerala is showing a certain level of stability, is that stability likely to continue? Are you concerned that we're still in a zone where things within a matter of days, and if not hours, could still change?
Rahul, Kerala represents the best case scenario for the rest of the states in India and also several countries in the world. So therefore, they have started early, they have done really good actions, and in terms of containment, they've done tremendously well job. And they're likely to continue the kind of ownership that is seen in the state. However, the focus now should shift on to West Bengal, Madhya Pradesh, Uttar Pradesh, and Bihar, and even Maharashtra and Punjab. And even in Maharashtra, you'll have to segregate Mumbai versus rest of Maharashtra. In this manner, if we focus, the action now should be at the state level and sub-state level, so that the districts are doing both containment and mitigation together and not just looking at some of the lockdown measures.
All right. Thanks very much, Dr. Babu. I hope to come back to you once the Prime Minister has spoken to try and understand from you from a public health perspective, what the implications of his plan for lockdown 2.0 are. But a very important guest, Devendra Sharma, is with us, and we want to focus with him on what's happening in the countryside, what's happening in rural India. That is hugely important. But before that, I need to take a quick break. When we come back, remember this is harvest season, and you and I, most people watching India Today at this time, will find a way of surviving. But for people in areas outside our big cities, outside the zones of those who are watching television at this moment, life can be tricky. We've seen some fissures build up in places like Surat. How do we ensure those are contained? We'll deal with that aspect when we come back on the other side of a quick break. We've got about half an hour to go before Prime Minister Narendra Modi speaks. You're watching a live and continuing coverage of India's battle against the coronavirus. Stay with us.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.